Namaste, Dr. Jyotsna.
Hi, Dr.
Hello, sir. I have joined.
Yeah, yeah, join. We'll start, sir. We'll start.
Yes, yes, yes.
A very good evening to one and all. I heartily welcome all the members of API, ICP Karnataka, and other members of various organizations who have joined virtually from all over the country to attend this program, World Health Day. This year, theme being Healthy Beginnings, Hopeful Futures. On this occasion, I welcome Dr. P.S. Shankar, Professor Emeritus, RGHS and KB University, Gulbarga. I welcome our other guest of honor, Dr. Muruganathan, who needs no introduction. Presently, the Director PRF API, the past Dean ICP and past President API, and the past Governor of ACP India chapter, who will be joining shortly, is held up in other program. I also welcome our own committee members, Patron API, Dr. Maya Sir, Dr. Suresh Sagara, Chairman API, Dr. Vishwanath, Secretary, Dr. Ravi Kirti and Srinivas Murthy, Central Committee members. I welcome our today's chief guest, Professor Dr. Jyotirmay Paul, President National API from Kolkata, a great academician, researcher who has taken National API to an international level by doing great academic events. A great name in the API family in the country. I also welcome our other chief guest, Dr. Pragya Yadav, the director in charge of the National Institute of One Health, Nagpur, and the scientist staff and group leader, Maximum Containment Facility, the ICMR National Institute of Virology, Pune. She is known for her research contributions in the field of biosafety, emerging, re-emerging high pathogens. Her exemplary work during COVID-19 pandemic with the successful isolation of SARS-CoV-2 virus from clinical specimens, which was then utilized by Bharat Biotech International Limited to generate the first indigenous vaccine, Covaxin, in India. Subsequently, she successfully led the team who carried out several preclinical studies using Covaxin, which paved the way for clinical trials. Her special roles and publications include is the Fellow of National Academy of Medical Science and the NAS India. She is member of many national and international committees on the biosafety and biocontaminant, helped in conceptualization of many guidelines for the high-risk viral diseases. She is on the editorial board of several journals. She has published more than 344 papers in national and international journals, including the Lancet and the Nature. Awards and recognition. She has been awarded with Dr. T. Ramachandra Rao Award for Outstanding Research in Medical Entomology, Vigyan Yuva Shanti Swarup Bhatnagar Award by the Honorable President of India, NAMS Women in Medicine Award 2024, Bharat Bhagya Vaidya Awardee by the Ministry of Culture, Government of India. I also welcome our today's speaker, Dr. Nandita Palshetkar from Mumbai, a great academician and a researcher who has delivered more than 100 orations and more than 1,000 lectures, authored more than 100 chapters and papers, and edited 25 books, the past president of FOXI, ISER, IAG, and so many other organizations. I welcome our today's moderator, Dr. Pramila Kalra, endocrinologist and head of the department of Ramaya Medical College, Bangalore, a great academician and a researcher. I also welcome our today's panelist, our own colleague who needs no introduction, Dr. Nandini Chatterjee, Professor of Medicine and the governing body member from Kolkata. I welcome our other panelist, Dr. Jyotsna Madan, Senior OBG faculty from Manipal Hospital, Bangalore. Let us not waste time by reading their CV profile, which runs in pages. Let us learn and hear from them. As I can see, many have joined virtually from many states of the country, making a national event, which COVID-19 pandemic has taught a new normal life to learn. Lastly, I welcome one and all. Now we have a formal virtual inauguration.
शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः दीपज्योतिः परब्रह्म दीपज्योतिः तज्ज्योतिर्परब्रह्म
We are virtually honoring all the faculties as well. Now I request our National President, Dr. Jyotirmay Paul, to address the gathering. Over to you, Dr. Jyoti.
Good evening. My congratulations to all my countrymen, all physicians across India on the occasion of World Health Day 2025, that is 7th April. Health and education, these are the two basic pillars for sustainable growth of economy of a country. This year WHO has given stress on healthy beginning so that we can get a healthy future. So healthy beginning means we have to give importance to the maternal health, the pregnant woman, the infant, children. But unfortunately, in spite of having massive growth, advancement in medical sciences across the globe, we are recording one preventable maternal or infant death every 7 seconds as per WHO data. We are ashamed for it because we failed to save the maternal life. So this year, as a President API, I have chosen and urged every member on two simple issues you pick up and go for campaigning. What is that? Number one, anemia is the most common medical complication in pregnancy. Almost 52% pregnant women in India suffers from anemia. And worm infestation is one of the major cause of anemia of pregnant lady in India. So that is why 2014 WHO, UNICEF and Government of India launched deworming program. India, what is that? Application of one single dose of albendazole 400 milligram after 20th week of pregnancy. That can change the outcome of pregnancy. So this, we physicians and all the practitioners not strictly follow this protocol. So I have urged, make a flyer to distribute among everywhere across the country, because today we physician, it is true, the pregnant woman will not come to us, but a young lady as a patient may come to us for some sore throat, maybe some diarrhea, maybe some pneumonia or other diseases. And we can make it aware of the lady that deworming is the right of every woman who is pregnant or going to be pregnant. So this simple measure can change the entire outcome. Number two, nowadays, our children, we give more stress only on academics. In our time, afternoon 4 to 6 was the time for the games, outdoor games. Now 4 to 6, we parents send our children for the coaching so that they can get a better marks. And children also concentrate more on the in-game game, the mobile game, computer games. So that is why today, as a symbolic event, today I have arranged a football match between the API President's 11 versus famous East Bengal Club of Calcutta. 4 past India team captain, Manoranjan Bhattacharya, then Vikas Panji, Alberto Dukunha, Phalguni Datto, they are the past captain, first India team player and captain. They participate in the game. This is a 5 minutes, 10 minutes game, but it's a symbolic. And also we arrange one awareness program of the parents, because the games, if you give importance in the early childhood, that the future non-communicable disease incidence can be decreased. So we doctors, we are much more involved in curative medicine, but now campaigning we doctors should involve more and more preventive medicine. So I have best wishes for the program World Health Day, and I hope that all the physicians we will give some time, 5% times of the per week for the preventive awareness campaigning of our Indian population. Thank you. Jai Hind, Jai API.
Thank you, sir, for sparing your valuable time. Now I request Dr. Pragya Yadav for our inaugural address.
Good evening, everyone. I'm very happy that you have invited me, and it was a very nice message from Dr. Jyoti Maya regarding the health. Some of the health initiative which we realized during the COVID that basically the comorbidity which played important role in making the situation worse during the COVID pandemic, and it also attracted the common man's attention that we need to focus on health, which we forgot in the race of becoming successful and gaining more and more success to our life. In the process of this, there was a many new initiative which was taken by Government of India. On 7th July 22, PM SITAC committee, which is led by Prime Minister himself, recommended to form a National One Health Mission, which was formulated and now it is in the action. And I would like to share some of the initiative for this audience, which is coming from different part of the country and joining the API. Very important day, which WHO is celebrating, but with globally people are celebrating this World Health Day. Today, Prime Minister himself has given message that we should focus on obesity, diabetes, and those parameters which is affecting, and it is going to not affect the older, younger, but also the coming up generations. In the some of the initiative which was taken immediately after the National One Health Mission was formulated, to bring all the ministry from central ministry, include the science, technology, health, and also the state government, industry, to bring them together to prepare the country for future pandemic preparedness. And these actions included and given some of the example, forming the National Joint Outbreak Response Team, where everybody will work together in case of any crisis or outbreak. And some of the examples were success stories were seen during the recent outbreak and crisis when it happened in Jammu. There was a death, and there was a multilateral efforts was used to find out what was the causative agent during the GBS outbreak in Pune, Nipah outbreak in Kerala, and so on. But this is just a beginning. There was a need for strengthening the different laboratory where they are working on a high risk group of pathogen. So a BSL-3 network is created, and then harmonization of SOP, treatment, and other process are in the place. But at the same time, there was in August, a national mock drill was done, where influenza-like sickness was created in one of the very remote area in Rajasthan, and all the stakeholders were asked to act. And initially, the information was kept very confidential, and nobody was knowing that which disease will be act as a mock drill. And once the mock drill initiated, then the front team started action from village to district, then state, and the central team. Everybody has to act. And then based on all the response, there was a gather team. There was a team of observer which was even taken from National Security Council, and they observe each and every point where we need to improve for such kind of outbreak investigation in the future. These are the some of the action which I'm seeing. But the major point which I would like to bring under the National One Health Mission, to bring everybody together, to address every problem together, so that we are not duplicating the problems, we are not working in tandem, and we are not able to address the problem as a whole. And as we know that we always talk about Vasudhaiva Kutumbakam, that is a philosophy of Indian culture, and which can only happen when we work as a country together. In the case of during pandemic, we also realized that we need to not only focus on infectious diseases, but also non-infectious diseases. And there was a beautiful demonstration which was done recently during the TB Innovation Summit in Delhi, which was organized by ICMR and also many international agencies, where we could demonstrate the TB, the 4 different actions, the prevent, detect, and how we can take care of such kind of disease by demonstrating innovations, which were more than 400 coming from India, and they were all indigenous innovations. So that actually showed the capacity of India. And in pandemic, we have again and again proven that given opportunity, chance, funding, and all these facility we can do wonders in our country, either the production of vaccine, therapeutics, PPE, and so on. And being a medical faculty, we all know that how we dealt the crisis of COVID from no PPE, no medicine, and no hospital facility, and how we went through this crisis. But in future, we should not have such crisis, and we should able to deal such problems in a better way. We need to have a cohesive policy plans from the national point of view, where we can act together. We can use not only the intellectual capacity of from each sectors and state, but also together we can formulate the guideline to treat such diseases. With this, I wish all the best to API and also entire country for having a better future, better health, and we should celebrate these more occasion by getting some kind of target that in and country is already working on TB eliminations program, leprosy elimination program, and malaria as well. And with lot of efforts, we could see the vaccine for malaria and treatment for different diseases are coming up. But we have to continue these efforts, and we also need to improve the health exercise, as it was mentioned by our earlier speaker, that we need to focus on the physical health and those kind of practices from childhood of the children, so that they can become better citizen and healthy individuals. With this, I would like to thank Dr. Sangram for invitation, and I look forward for listening a wonderful panel discussion, which is ahead of the time. Thank you very much.
Thank you, madam, for accepting our invitation and to be part of this program. As you are aware, we did a TB eradication program last World TB Day also. We will be doing all regular programs as well in the interest of the nation. So now I request Dr. Suresh Agrath, to Chairman API, to address for you.
Thank you, Dr. Sangram sir, for this initiative in this series of webinars. Karnataka ICP is doing a wonderful job under your leadership, and today we are celebrating World WHO Day, and aptly the slogan is healthy beginnings, hopeful futures, and we all know that a good beginning of work is done. So we need to focus on, as our President API has been telling for last few days regarding the MCH care, and we need to focus on this for better future. And already our President Jyotirmay Paul has highlighted the importance of deworming and correction of anemia to aid the maternal and child health care. We all know that even when we talk of CVD and other non-communicable diseases in the adulthood, they have link in the goes to maternal health as well as the fetal health. We have demonstrated fatty streaks in fetuses also regarding atherosclerotic disease burden subsequently. So we need to focus on this area so that the future generation will be healthy. So with this few words, I conclude my talk. Thank you, one and all.
Thank you, Dr. Suresh. Now I request Dr. P.S. Shankar sir for your introductory remarks on the topic. Yeah, unmute, go on. Unmute, sir. Unmute. Kindly unmute.
Dear colleagues, we have assembled to celebrate the WHO Day that is celebrated all over the globe. And World Health Organization celebrates its day on 7th April each year with a theme. This day marks the anniversary of the founding of the World Health Organization in 1948. The first World Health Day took place in 1950. Since 75 years, it has focused on different health themes, each year addressing critical health concerns such as mental health, clean water, and infectious disease. Each year, World Health Day is used as an opportunity to draw the attention to a specific health topic that affects people all over the world. Thus, World Health Day encourages governments, healthcare organizations, and individuals to work collectively towards improving the health standards and access to the healthcare. The current year theme is Healthy Beginnings, Hopeful Futures. World Health Day holds a significant importance as it serves as a global reminder to prioritize health and well-being. The day brings attention to important health issues from infectious disease to the mental health and encourages people, communities, and the government to take action to improve healthcare systems, and it highlights the need for universal health coverage, equitable access to healthcare, and the importance of preventive care. And the health of mothers and babies, the foundation of healthy families and communities, which ensure hopeful futures for all of us. This year long campaign on maternal and newborn health will urge governments and the health community to ramp up the efforts to end preventable maternal and newborn deaths and to prioritize the women's longer term health and well being. Current estimates show that 3 lakh women lose their life due to the pregnancy or childbirth each year, while over 2 million babies die in their first month of life and around 2 million more are stillborn, many of whom could have survived with timely medical intervention. And that is roughly one preventable death every 7 seconds. Women and families everywhere need high quality care that supports them physically and emotionally before, during, and birth. And this has necessitated that health systems must evolve to manage many health issues that impact maternal and newborn health. These not only include direct obstetric complications but also mental health conditions, non communicable disease, and family planning. Additionally, women and families should be supported by laws and policies that safeguard their health and rights. In addition, there is a need for quality care that supports them physically and emotionally before, during, and after birth. WHO is calling for a worldwide reinvigoration of efforts to ensure access to high quality care for women and babies. Women everywhere need access to health providers who is to listen their concerns and meet their needs so that they can plan their lives and protect their health. Health of the mothers and the babies is the foundation of healthy families and communities, helping ensure hopeful futures for all of us. Prioritizing a regular health checkup throughout pregnancy can help with early detection and the management of potential complications. It is also crucial to educate people about the importance of nutrition, physical activity, and avoiding harmful substances and during the pregnancy. Mental health is often overlooked but is vital during and after pregnancy. One has to seek professional support if required, and it is also important to ensure that women have access to healthcare experts and infrastructure during pregnancy, labor, and delivery. Also, mothers should have access to postnatal care to monitor their health and provide support in caring for the newborn. The health of the mothers and the newborns is not just a medical issue, it is a foundation of the societal well being. When women receive proper care before, during, and after pregnancy, it leads to healthier families, reduced infant and maternal mortality, improved community development, economic productivity, as healthy mothers are more likely to participate in the workforce. The campaign has become operative with the goals to raise awareness about the gaps in the maternal and newborn survival and the need to prioritize women's long term well being, to advocate for the effective investments that improve the health of women and the babies, to encourage collective action to support parents as well as health professionals who provide critical care, to provide useful health information relating to pregnancy, childbirth, and the postnatal period. Maternal and newborn health is crucial for several reasons as it directly impacts the well being of the mothers, infants, families, and communities. Improving maternal and newborn health can significantly decrease the rates of the maternal and infant mortality. Thus, World Health Day 2025 is not just a symbolic observance, it is a call for action. The WHO urges governments, NGOs, international partners, and individuals to prioritize maternal and newborn health in the national health agenda, invest in infrastructure, especially in rural and underserved areas, educate communities on the importance of the maternal and child health, and foster multi-sectoral partnerships for the better healthcare delivery. We have assembled here to celebrate the WHO Day and are eager to hear the lecture on nurturing new beginnings, followed by the panel discussion. I am happy to associate in this program and wish the program all success. Thank you.
Thank you, sir, for the overview of the theme for WHO. Thanks for sparing your valuable time.
Thank
Now I request our moderator, Dr. Pramila Karla, to take over for the scientific sessions. Since all the faculties have been introduced, over to you, Dr. Pramila. Hello. I think she's held up. Now we move on to the scientific session. First talk.
Good evening, everybody. Today, I'm going to be talking on the World Health Day on nurturing new beginnings and advances in infertility care. I think keeping with the theme of the year, I would really like to take you in depth about infertility. Look at this. This is what naturally happens. This is how the new beginnings occur. But when this doesn't happen, this is the fallopian tube where the oocyte is sitting and waiting for the sperm. And then one of the sperm, millions of sperms try and get in, but one of the sperms is able to go in and fertilize the oocyte. But when this doesn't happen naturally in about 17.5% of the people, as quoted by the WHO study, in India today, we have 2.7 to 3.7 crore people who are infertile. The most important part, I feel, is if you want a beginning to be healthy, you have to prevent infertility. And how can you do that? Maintain a healthy lifestyle, practice safe sex, avoid unwarranted pregnancy, monitor menstrual health, limit exposure to environmental toxins, contaminated foods, there's a lot of contamination, manage chronic conditions like diabetes, blood pressure, hypothyroidism, protect against sexually transmitted infections, consider fertility preservation, which is the new kid on the block, and it should be offered to a lot of girls. Stay informed, regular health checkups, manage stress with either mindfulness, meditation, and relaxation exercises, and seek medical advice if no conception. So conceiving a baby another way, remember that if a couple has tried for 1 year, and they still haven't conceived, they definitely need to see an infertility specialist. And especially if the girl is older than 35, then within 6 months, she should definitely approach the doctor and do some tests. And if the couple is 40 plus, it will not harm them to do the regular tests, at least a serum AMH and a semen analysis and an ultrasound before they start trying. Because it's important, if they have a problem, they can be treated faster, as age is very, very important. In 1500s, Harvey is the one who actually started the basis of reproductive endocrinology. Before that, everything was the sperm. Aristotle said sperm is important, but Harvey was the physician to King George I first, and he's the one who said, no, egg is very important, and egg is the one which life begins. But remember that 1978, it took so many years, the year that changed everything. In fact, what we see now, we are on Zoom right now. The first online exchange forum actually made its debut in Chicago in 1978. Sony invented the Walkman, but without doubt, the technological advance that rivaled humans walking on the moon was the birth of Louisa Brown, our test tube baby. And here she is, 40 years old, and she'd come to this conference in ASRM, and I had the opportunity to meet her and get her book signed by her. IVF is simple. It's creation of the baby outside the body. And as you can see this on the screen, this is an ultrasound image of aspiration of the oocyte. So a needle guided by the ultrasound enters that follicular fluid and aspirates the follicular fluid. And this is how the egg looks under the microscope. The black dot in the center is actually the oocyte, and the surrounding is the cumulus mass. And in IVF, what we do, this is under HIPAA, we put this egg, which is in the center with the cumulus mass, and 50,000 to 1 lakh sperms are put in that dish. And then, of course, they're kept to incubate for 4 to 6 hours. After about 24 hours is what you see is we try and see if the oocytes have fertilized. And this is how we detach the cumulus mass. And you can see the 2 pronuclei in 5 out of the 6 oocytes. That means 5 of them have fertilized. And then, of course, in the lab, ICSI is done. So not only IVF, this ICSI is another process which was launched in which the first baby was born in 1995, and it overcame male infertility. Here, as you can see, the sperm is taken and injected directly into the egg. So it's a very good technology for male factor infertility, where you take 1 sperm and inject it into the egg, because either the sperm count is too less or the sperm is too weak. Sometimes the egg cover, the cumulus mass, can be tough and it does not allow the sperm to penetrate. So all these cases, ICSI is indicated. Assisted laser hatching was something that we launched in 1998, and our first baby was born. It was a technology where the laser is used, as you can see, it is drilling holes in the zona pellucida of the oocyte and the embryo, and this helps in the embryo to hatch. So sometimes when patients with multiple failures, patients of older women, frozen embryos have a thick zona, and that zona needs to be drilled, and you can do like zona thinning or zona hatching, that is create an opening, and this helps the embryo to implant. And our first baby was born in 1998. Now, I'm going to just discuss patients so that you can understand what different technologies are being used for these patients. Today, if I sit in my OPD, nearly 1/3 of my patients are low ovarian reserve. You do the serum AMH of these girls and it is less than 2. And it's all probably a genetic reason, probably because of pollution, because of contamination. Sometimes it could be because of tuberculosis also. So we need to rule out all these factors, and of course autoimmunity. So we need to rule out all these factors and then work on them. So this was a young couple, 28 years old, 31 years old was the man. They were married for 6 years and came to the OPD with primary infertility. This is very typical, because when you're young, you don't really go to the doctor quickly. They waited for 6 years to come to an infertility specialist. In the meantime, they had done 2 cycles of IUI. With us, they underwent 2 embryo transfers, both aborted at 6 weeks. Now we needed to do a little bit extra testing because she had aborted. So we decided to do precision medicine. Precision medicine is individualized medicine. So here we do the genetic testing, we do some biomarkers in the blood, we do immunity testing, and then we come to a plan for the patient. So as you can see, this is the genetic report of the patient. Here, 700 genes of the girls and about 400 genes of the man are studied, and they look for the SNPs. And these SNPs tell you that the polymorphism which is present. Remember that polymorphism is just a risk factor. It's not a mutation. Mutation causes disease. but these polymorphisms actually tell you that this patient is at risk. If you can see her report, AMH receptor R2, ESR1, and LHCGR genes are affected. Now, with these genes, you can see that she needs a higher dose of the gonadotropin, and exogenous LH is required. So it actually is like pharmacogenomics. It tells you what to do in the patient. And in the man, fortunately, there was nothing that was seen. So what we did was we took the embryo, we biopsied it, studied it genetically. This was a single euploid blastocyst. So the genetics said this blastocyst was absolutely normal. We did a frozen embryo transfer with this blastocyst and fortified luteal phase support. So we give a lot. We give a platelet-rich plasma, we give LMWH, we use GCSF and intralipids also. Artificial intelligence technology was also used to assess the best embryo, and patient conceived and delivered a healthy baby girl in December 2022. Hematologist reference for RPL. Hematologist reference for RPL and deranged coagulation profile was done. 40 units of LMWH was advised throughout pregnancy and to continue post 6 weeks. Now, let me take you through the technologies that were used. This is the spindle view. You can see the whitish kind of a white blob at 12 o'clock position. It is where your chromosomes are. You can identify this on the polyscope or the spindle view so that you don't damage the chromosomes when doing X. This is especially useful for patients who have low ovarian reserve. Now, oocyte vitrification. Now, for low ovarian reserve, we also do this process. You can see Diana Hayden with 3 children, Ekta Kapoor with her child. These are 2 celebrities who have come out in the open. They came to me when they were 30, 32 years old, and they froze the eggs. And these are the children that they got from the frozen eggs 8 to 10 years later. And of course, the youngest one with my son, same generation as Natasha Suri, who's frozen her eggs with us. Now, artificial intelligence is this technology which I am showing you on this video. Okay. I think the video is not working, but you can see the report on the right. So photographs are taken of the oocyte and they are uploaded to the server, which is in Sweden. And that is where it is put, all the data is put together. It's compared to the data. There is a Indian data also. And the oocyte, the outcome of that oocyte is predicted. Like it will likely to fertilize, blastocyst, and even the live birth rate of frozen oocytes can be obtained. So in patients who want to freeze their oocytes like Ekta and Diana, we can actually do artificial intelligence on them and tell them how many eggs they need to get a live birth. Recently, I did one patient and she had 15 eggs and a 60% live birth rate. So remember that its ability to predict fertilization and blastocyst development is within 91.2 and 63% accuracy respectively. Comparative studies of cryopreserved oocytes, if you can just look, these are multiple studies from different groups, and you can see the last one is my group, which we published in 2023. We have frozen 1,700 eggs with a 98% oocyte survival rate and fertilization rate of 72% and the pregnancy rate of 60% in these patients. Let's go to the second patient, which is recurrent pregnancy loss with repeated IVF failures. 32-year-old XYZ, married for 7 years, came to us with secondary infertility. She had already had 3 abortions and natural conceptions. Chromosomal analysis of abortions was normal. So, we do a microarray when we have a missed abortion. They had already done 2 IVF cycles outside, both were unsuccessful. I did 5 IVF cycles. She had 3 blastocysts, which were hatching. And we did a very new technology called non-invasive chromosomal screening. We got a report of 2 embryos which were euploid, which is normal. We transferred 2 embryos and she became positive, and a healthy baby boy was delivered in January 2021. This is how the genetic testing is done. This is the blastocyst, which you can see the biopsy is being taken. It's a very invasive procedure. And let me show you how you can do it. You can analyze the number, that is aneuploidy. You can analyze structural rearrangement. You can analyze monogenic diseases like thalassemia, sickle cell, etc. And there is also polygenic. Polygenic means multiple genes are responsible. Let me show you this technology. So you saw the previous movie where the biopsy of the embryo was actually taken. Here we are not touching the embryo. In this dish, it's transferred to another dish where it is kept in the incubator and frozen. And the fluid which is there remaining, in which the embryo was cultured, is actually taken and frozen. And then that fluid undergoes a genetic test. So we are not touching the embryo, it is non-invasive. Our first paper was published in 2021, where we, the baby born from this technology is a case study has been published. So this is non-invasive. Non-invasive genetic testing can be done on the embryo, especially when the woman is older. You don't want to damage the embryo. When there are less number of embryos, and its accuracy is about 90%. So this can definitely be used in a lot of patients. So thalassemia major patient this was a patient XYZ from Nigeria with secondary infertility, came to us for treatment. 3 times termination of pregnancy was done because the amniocentesis showed that thalassemia major fetus in all the instances. Plan of action, we decided to do ICSI with PGD, followed by hysteroscopy and frozen embryo transfer. We got 6 blastocysts, and you can see the report. There were 2 normal, 1 had thalassemia minor, meaning they had a trait. And those 2 normal blastocysts were transferred. Patient came positive. We always advise that you must do Coriolis sampling, which was done at 10 weeks. The baby was thalassemia free and the baby was born. So I think that's important to understand that genetics has really changed the whole way in which we treat patients. Now a patient of azoospermia. He was 32, the lady was 32 years old, married for 3 years. Husband had azoospermia and he was, I think, 32 or 33 years old. Reference with andrologist, and we did a microdeletion, which showed he had no microdeletion in the Y chromosome. So MTSA with ICSI was planned. The lady's AMH was 3.6. She had done outside 2 IVFs were negative. MTSA was done, but nothing, it was negative. I did 6 pickups, 3 times testicular biopsy. So remember that we wait for 6 months before each testicular biopsy. So they were there with me for a long time. 3 fresh transfers, 7 frozen transfers were attempted in this patient. 1 missed abortion, 1 ectopic pregnancy, hysteroscopy in 2014 was normal. Now current cycle, MTSA was done. We used a lot of technologies. You know, she was with me for nearly so long, but she said, no, madam, only you are going to be pregnant because I know you're working very hard. I think it's very important to have belief in your doctor. We did IMSI, we did MAC, we did assisted laser hatching and embryoscope. And I'm going to take you through the technologies after I finish telling you what happened to this patient. Embryo transfer with 3 embryos was positive. She conceived triplets. Patient was not willing for reduction after this. The placenta was low-lying at 14 weeks. Patient came from Kashmir to Mumbai with all precautions at 15 weeks. We did a cervical circlage for the patient and complete bed rest till 28 weeks. She went into labor at 28 weeks. Patient delivered 890 950 and 1.1 kilo babies. NICO treatment was given and triplets are discharged. And you can see she sends me photos on their birthday every year. So this was the technology that we used. This is micro TSA. Sorry. This is micro TSA. No, I think the videos, you can see this tubule which is there on the screen. Now that is filled with seminal fluid. So we take it and we milk it out actually. So we just milk it under the microscope and you find sperms. And then these sperms are put in a droplet and these are then picked up and ICSI is performed. Another technology, suppose there are extra sperms. See, we have sperms. We saw that carrier and put the sperms in that. So we can freeze 25 sperms, 50 sperms in that, which is not possible in any other technology except sperm breeding. And this is the technology we got for the first time in the country. And the few sperms can be frozen in this. The other day we had 6 sperms frozen in it, and we used them to create embryos. So IMSI is what? IMSI is enlarging the sperm 7,200 times. So when the sperm is enlarged 7,200 times, we are able to identify the length, the breadth of the head of the sperm. And if there are any cytoplasmic inclusions, any vacuoles, etc. And that way we can grade and find the best sperm. Now, in fact, artificial intelligence is also added to this and it helps you pick up the best sperm. So that is something that will definitely give a better success rate. IMSI, we use it in cases of
some microfluidics. So using some microfluidics technology, I have not yet read it properly, so I can't tell you the.
Okay, this is the video which we made in our lab, and this is how the sperm is in the syringe and we inject it, and it passes through channels and membranes, and only the best sperm comes. This is a big syringe, so obviously it is for IUI, but when we use a small amount, we can use it for IVF, and it's a fantastic technique, and this was the technique that was used for the patient. So Sion double murder case. You'll have all heard of this double murder case, Sheeta and Santosh Railkar. They have talked about it, and that's why their names are there in it. Age 37, they had conceived naturally in 2008, had a beautiful daughter who was delivered vaginally. On 3rd June 2011 was the darkest day of their lives, and 55-year-old Sheetal's mother and the small child was murdered just for 3,000 rupees. Family fought for justice for 7 years, and of course the person who had done the heinous crime was punished. But with the thought of continuity to life, patients arrived at my clinic for IVF treatment. They were not that affording at all. We did one IVF, first ET, 3 day 3 embryos positive, and she conceived with twins. The treatment was done completely free of cost so as to give a life to the devastated couple. She delivered preterm a baby boy and a baby girl. Babies were kept in NICU for 3 weeks and discharged. I think, we as doctors do a lot of free work, and we need to, because the image of the doctors has to change, the perception of the public has to change, and we need to highlight what we do and document all our charity work. Unfortunately, we always did it quietly, but I think it's time to document it. And this couple was really happy, and they were, they look at the smiling faces, look at the joy on their faces with the twin babies. I mean, I don't know what else to talk about them. So what we use is this technology. Look at this embryoscope. This is 2012. This is with Diana Hayden, and this is the embryoscope. And look at 2022, Natasha Suri with Dr. Rohan Palshetkar. That is the next gen. And you can see the difference in the embryoscope also. We, of course, traded our old embryoscope for the new embryoscope. And the new embryoscope is with artificial intelligence. I want to tell you that this AI technology we have been using in the lab pre-COVID. It's nearly more than 5 years. And this is the technology that we're using in the lab. It actually is a time-lapse system which analyzes the embryos, and it follows it every, there's a movie made and follows it every 15 minutes. And you can actually compare the cohort and see what is the what is the quality. So ovarian rejuvenation is an important, make it silent, no? Ovarian rejuvenation is a technology where you can rejuvenate the ovaries, medicine, PRP, stem cells. And what we use is PRP and stem cells to rejuvenate the ovaries. This is a beautiful new technology I had heard. Can you see this? I'm going to play it and you're going to actually see the chromosome separating out is the spindle. Oh my God, none of these movies are working. I'm really sorry about that. But you can actually, these blue dots actually highlight and show that this spindle is splitting. This is live imaging of the human blastocysts. This technology today is being, it's already there and studies are being done so that it can come into clinical practice. So we will not, we were moving towards non-invasive. So we will not have to biopsy the embryo, and we'll be able to, with this technology, with the help of artificial intelligence, we'll be able to identify which embryo is absolutely normal. It's working. One sec.
Embryos, we did it in the mouse model and in the human model.
You can see the chromosomes, how they split up. Okay? And this is the lecture which I heard, and it was very fascinating. Look at this biobag. They've grown this lamb in the bag outside the mother's body. And similarly, I think we will be able to grow babies. Today, we can the babies can survive up to 20 weeks, especially in Sweden. In India, 24 weeks and above, we can survive the babies. So we have to bridge the gap between the blastocysts to the 24 weeks, and I'm sure it will happen soon. And that is known as exogenesis. 3D bioprinting, you can actually print an organ. You can build a scaffold of ovarian, of the ovary, and then put stem cells, the germinal vesicles, and you can create the ovary. So soon that will be an option for patients with poor ovarian reserve. This is CRISPR, this is how the chromosomes in your body are doing transcription. The DNA gets converted to RNA. This coil, double coil, is the DNA, and the single coil which is coming out is the one which is being copied and converted into an RNA. Remember, the DNA has billions of genes, billions of proteins it can produce, but every cell produces only 2 to 3 proteins, and that is coded in the RNA. And this is how the protein which is at the end, junction protein, actually copies the DNA, creates the RNA, and then produces protein. So that this is happening in billions of your cells right now as you're watching the video. So this is my final slide, and there are 10 new technologies which were launched in the medical world, and as you can see, 8 out of the 10 are in IVF. That is how exciting this field is, and that much we're using it. So it's a fantastic field to be in right now, with superb results and with technology to help every different kind of patient. And that is why I think it's important that people do opt for this technology and come for treatment. I feel that the current challenges that we face are, of course, high cost, limited availability in rural areas, and lack of insurance coverage. And believe me, we have budget IVFs. We have now centers which are going towards tier 2 and tier 3 cities, and insurance is coming up with a cover. So I'm very happy to say that, and thanks to my patients. This year we celebrate 25 years at Leelavati Hospital, and I would just like to say thank you to all of you for coming. And what we want is beautiful babies like this. Thank you. Would love to answer any questions if there are. Thank you, Dr. Sangram. Really, thank you for doing such a seamless, presenting the my recording.
Yeah. Over to you, Dr. Pramila Karla.
Yeah, thanks, Dr. Sangram, and thanks, Dr. Nandita. It was really, really nice, and we came to know about a lot of things because I'm an endocrinologist. So, but the newer things and the AI use which you told were definitely very good. And we have this panel discussion now. So I welcome the panelists. So Dr. Nandita is in the panel, Dr. Jyotsna, Dr. Bharti, and we also have Dr. Nandini, but I'm not seeing her online. Is she there?
Yeah, she is held up in other programs. She'll be joining shortly. You can continue with
Okay, so we'll start the panel and then we can ask the questions to her when she joins. So today we know that this is the occasion of the World Health Day, and we are talking about healthy beginnings. So we know the healthy beginnings translate into a healthy future and a joyful future. So, and we are discussing about women's health. So as it is at the present moment, because all of you are gynecologists, so we'll be discussing more about the women health. So starting with Dr. Jyotsna. So Dr. Jyotsna, what are the common reproductive health issues which you see in women? Like, what are the common things which they come to you for? And what do you think we need to be aware of? Or when we are talking to women, we need to particularly be aware of those things? You can unmute yourself, Dr. Jyotsna. You're muted. Just please unmute yourself. Yeah, thank you.
Good evening, everyone.
Good evening.
Yeah. So I think tremendous changes have come over the last 3 decades compared to what it was 30, 35 years ago. Now there has been a lot of some awareness. I don't say a lot. Some awareness has been there, thanks to probably Dr. Google. So they would come to us preconceptionally, or most of them do come preconceptionally in at least metro cities. But little outside the metro cities, they do know that they can take folic acid beforehand. It's before planning for pregnancy, but they always want to be sure. Like Dr. Nandita pointed out, a lot of them are becoming aware, even the common public. Forget about celebrities. They are coming and asking at the age of 27, 28 years, doctor, we do not, unmarried girls are coming up for oocyte preservation. So, which is not actually not accepted now, right now. It's for the married couple or the, when the couple come, oocyte preservation can be done. But many times they come with known history of diabetes, hypertension, though anemia is little commoner in the rural population and less commoner in the urban population, still we do come across patients with a lot of family history of genetic problems these days. And they do want to be sure, somebody had this problem, or I'm married to a third cousin, or somebody in the family is having some such condition. How sure are you, doctor, that I'm not going to have such a baby? That kind of awareness has been there to a certain extent. So they come preconceptionally, they come in the early part of their pregnancy to be sure things are all right. And according to the reports, they continue following us.
Can I
interrupt? So thank you. Yeah, definitely. I'm coming to you. So Dr. Jyotsna, nice that you told about the awareness in the population, especially in the urban population, about their health status, and they come to you before they plan for conception. But I would like to add that as an endocrinologist, no, I'm coming to you. I'm just coming to you.
The point which she said.
Yeah, I'm coming to that IVF point, and I have one more question for you as well. So I will ask both those to you. So when we talk about reproductive health, we know that they do come to you when they are planning for conception. But what we see commonly as an endocrinologist also, what we see is they come only at that time. They don't come before. So what we are advocating that they should get their health checks done before rather than just 2 months or 3 months prior when they are planning for conception. So just going on to Dr. Nandita. So Dr. Nandita, you can definitely take that point. And also I would like to ask you another point about the oocyte preservation, because we have oocyte preservation, which Dr. Jyotsna was alluding to, and you will be adding to it. And also, what are the laws for this? Because what has happened is I also treat a lot of transgender. And when after the age of 18 years, we can start them on cross-sex hormone therapy. So what are the guidelines for the oocyte preservation? Because many a times the IVF centers refuse to bank their oocyte, and they are told that this is not possible for them. So can you please allude to the guidelines as well as take the point which you wanted to talk about?
Yeah, Dr. Pramila, I think it's absolutely wrong that the IVF centers are refusing oocyte freezing. It is absolutely legally allowed in the law.
Okay.
You have to be 21 years and more. You can be single, you can be divorced, you can be married, and you can still freeze your eggs.
Right.
Okay, so it's absolutely, in fact, the law very clearly states that the woman can freeze her eggs for however long she wants.
But
And
what
there is
about 18 years plus? 18 years to
No,
21 years.
21 and older. You can't freeze.
That's the
before
problem.
21.
Yeah.
Okay, you can't freeze. And 18 anyway is too young. You know, it's
See, the problem for us is we treat gender affirming, we give gender affirming hormone therapy, and they start 18 plus.
You can do is you can freeze the ovary if you can remove the ovary.
Cryopreservation. Yeah.
Giving, changing their sex. So you can remove the ovary, freeze the ovary. Today, ovarian freezing is not experimental at all. It is permitted for prepubertal, patients of cancer and other things. So if you're doing transgender, I think that would be a good way to go about. But even then, I don't know. A good question. Let me ask you that supposing you've given testosterone to this person for the sex or whatever, can you at the age of 21, 23, just stop it for some time, stimulate, collect the eggs, so you don't have to do an invasive procedure like removal of the ovary and freezing it?
See, what happens that when we treat transgenders, many of them, they don't do the surgeries early, and we can do this, stopping the hormone therapy for 3 to 6 months and retrieving their oocyte. But what happens that many of them are going for surgeries at the age of 19 and 20, they're going for oophorectomies. So the problem comes there, because there the guidelines are not very clear. So there the problem comes because some of the centers tell them that we can't do anything for you. So they end up not doing anything, no banking, neither the cryopreservation of the ovaries is done. So that is the problem we are facing.
You can do it. There's no law stating that ovarian cryopreservation has, because for prepubertal patients in cancer and all, we are permitted to.
Yes. So you were trying to answer one more question which you were raising your hand for.
Same thing, that ovarian oocyte freezing is permitted by the law. And I'm sure if your patient is 18 or 19, if you take permission from the central board, the central board is very active. It gives permission for transfer of embryos and all. This is a special case which can be told to them. And I'm sure you'll get permission to do it because it's a very simple process.
Right. Thank you, Dr. Nandita. So, Dr. Bharti, coming. Yeah, please go ahead.
Dr. Nandita, just recently, just about 2 weeks back, we had one fertility conference here, and there, the particular week, I had 3 girls between the ages of 28 and 30 asking for oocyte preservation. But then when I discussed with my fertility specialist, I do not practice IVF. So when I was discussing with them, they said it doesn't permit unless she's married or she wants to go ahead.
Send them to me. I'll freeze them.
My Bangalore colleagues told me that.
Don't worry. We send them to Bombay. They will do it. I have a lot of patients coming from Bangalore.
I think there is still a lot of confusion about the laws. I fully understand. So there's a lot of confusion, I think, because I have also, like with my transgender, I face a lot of issues doing the thing, and I have to make many phone calls and get the things done. So I agree that there are a lot of issues, and some of the guidelines are not very clear to some people. I think that is also there. So that's why.
See, you have to be understand that the law is very, very clear.
That's why.
It's the age which is the limitation. And girls who are not transgender, see, they can freeze at 25, 28. We are not before 21.
Absolutely.
Transgender is a very special case. In fact, we are not even, allowed to do surrogacy for them and stuff.
Correct. I know. Yes.
This is a special condition which we can definitely talk. And if you're removing the ovary, you're keeping the uterus?
Yeah, then we can. No. They are removing the uterus and the ovaries, or they are removing only uterus.
Pointless, because doing surrogacy will be very difficult for us.
Yes, I know. But these are all the problems we face because the laws are not very clear. Like they want to do and they say, we'll see later. So we really don't know how to go about it. That is why the problem comes in.
Because it's not accepted in our country. See, the law of the country is very clear that what is not allowed in the country will not be permitted in the ART law. So because they are not really accepted the way, and marriages are not accepted, I think so far they haven't yet come up
No,
with that.
as of now, it is not legalized. Yeah.
So I think till the marriage gets accepted, this fertility and reproduction will not get accepted.
Absolutely, agreed. So, Dr. Bharti, coming to you, we did discuss about the different reproductive health issues, and when they get married or they're planning for pregnancy, they are the most receptive. We know that. But what about before that? Like when we talk about young girls, their nutrition, their reproductive health, how do we go about that, especially in the rural population? Because what we are seeing is the people are not at all aware. They just come into the picture when the day the girl gets married at 18 years, the parents bring them. Even we are getting turners after 18 because now they are planning for marriage and they want that. Now you see why she is amenorrheic, why her periods have not started. So what is your take on that? What is the your experience with the nutrition as well as with the reproductive health of young girls, like how, whether they are brought to you, and especially the rural population?
Well, thank you, Dr. Pramila, and I thank the API Karnataka and API the national branch for having us here. Just a small note on the previous question you were addressing. I think, see, oocyte freezing is done even in Hassan, which is a very, very small town. So I think even in Bangalore, I have had few of my girls who have come, people known to me who come from abroad. They've come from Singapore, they've come from Bangalore, from US, they have come to India, and in Bangalore, they have got their oocytes frozen. I have got my own kith and kin's oocyte frozen in Hassan. So I think there's nothing to be doubtful about that. And I do speak to all these career-oriented girls that please do think about freezing your eggs. I speak to them whenever they come to me for advice. That's the first thing. The second thing, coming to your question, for me, I want to tell you that we have to start very, very early when we speak about reproductive issues and healthy beginnings for a hopeful future. So my concept is, I am an ardent adolescent health educator in my region, and we do a lot of adolescent health awareness programs for the boys as well as for the girls. We start from high school, that's around 7th standard we speak to them about nutrition, we speak to them about lifestyle, we speak to them about vaccinations, and we also speak to them about a little about contraception and reproductive issues. So we have to start very, very early, especially we are seeing an increased incidence of obesity, polycystic ovarian diseases, hypothyroidism in the younger generation. And I would like to differ with Dr. Jyotsna that even today, the people coming to us for preconceptional care is dismally low. I would say just about 2 to 3% of them, even in the high-end, high-income groups, do not come to us. So I always tell them, you people take appointments with your beautician, with your musician, and everybody, but you never take an appointment with your family physician for a preconceptional advice, even much before they get married, even before they get engaged, because we see a lot of unintended pregnancies in these girls when say these couples when they are engaged and they're having unprotected sex. We are seeing STIs in these women, and we are also seeing many of them come to us with uncontrolled hypothyroidism. They're already 5 to 6 weeks or 8 weeks pregnant. They have hyperglycemia. So I think the point here is we have the API physicians with us here. It's a multidisciplinary approach. Any physician, whatsoever specialty they are, whether they are an endocrinologist, whether they're a physician, whether they're a pediatrician or a family physician, take every opportunity to speak to every male and female who comes to your clinic. They may be in their 60s, but they have children at home. They have daughters and daughters-in-laws at home. Talk to them, and sons and sons-in-laws. Please talk to them about preconception care, which encompasses nutrition, lifestyle, giving up substance abuse like alcohol and smoking, and supplementation with vitamin D, folic acid, or whatever they are deficient in, which has to start very, very early. And I think all of us have to join hands for these healthy beginnings. Just as obstetricians, we will not be able to do this.
Absolutely, I fully agree with you because, as you rightly pointed out, that the problem is not that they don't come to us when they are trying for conception. The problem is before. And as endocrinologists, we do see lots of uncontrolled hypothyroidism. The first time in their life, they would have checked their thyroid when they conceive, or even diabetes, and they are picked up and they come with very high HbA1cs of even 12, 13, and they are pregnant. So this is a usual thing. And now, because the age of pregnancy is advancing, we are seeing even more diabetes at the moment because they are conceiving at a later age. And then we are seeing more and more patients coming to us with this, and especially also hypothyroidism and many other metabolic
And
illnesses.
the lifestyle is taking a huge toll on the non-communicable diseases.
Absolutely, fully agree. So, Dr. Josna, coming back to you now, when we are talking about this reproductive health, and when you talk about the regular health checks needed for women, so at what age you recommend that they should start getting regular health checks, or at least some basic checkups with a gynecologist, so that the basic diseases or anything which they need to be aware of are taught to them, or they can be caught at that point of time and treated?
So here, most of my patients are like, elderly who come for gynec problem. When they are accompanied by their daughter-in-law, and I just get into the family history, and I have this habit of counseling them. So I say, you go for a health check, but then the other younger ladies at home, you get them checked as well. So what if your daughter is not married? So what if your daughter-in-law is not planning for a pregnancy? Let them have a checkup. Let's see what is hidden in her body. That's how I coax them. And here, actually, like word of mouth, a lot of them come to us, they just put their file forward. Doctor, I have PCOS. Doctor, I'm a thyroid patient. Or of late, soft copies. They just put the mobile in front and they show us the reports. That's when I say, no, let me take the history. Let me do the examination. Then let me look at your report and counsel. If you have a sibling at home, get them to us. And preconceptional counseling, I would have started not when they come preconceptionally, but then just after when they get married and they say they do not want to plan for pregnancy for 2 to 3 years, that is when I say, no, you prepare for that 2 to 3 years later pregnancy now itself by taking care of your health, by lifestyle modification, by eating healthy, sleeping well, all these things which are important. Of late, probably some of these companies, word of mouth, friends, what friends say matters a lot. So many of them do come. That's when a lot of those 3 girls came in 1 week's time, asking for oocyte preservation. So what they discuss in the office really matters. I think next day they just come back to us. I see quite a few of them whom I can really counsel. But then there are very few who come with HbA1c of 11, 11.5 and TSH of 100 units, 100 milli international units also I have seen. So, but still that has become little rarity, at least in the population I have been seeing over the last few years, 4 or 5 years, that incidence has reduced, I can say. So because they're all, and companies are promoting health check. So that's one more reason why they're getting to know what is wrong with them. But then they just get the test done and keep, some of them are still ignorant, keep quiet, but many of them really approach their doctors and take some treatment.
Correct. So, yes, well pointed out. And then Dr. Nandita, you see a lot of IVF cases and you're a specialist in that. So what about the mental health? Because do you have a psychologist in place, or do you have people who are catering to their mental health needs? Because we see that when the women are undergoing IVF, they're under a lot of stress and it's a lot of family pressure and many factors are playing a role. And they may be having other comorbidities like diabetes and other things, and everything is going on at the same time. So that gives a lot of stress to the women. So what about their mental health? How do you take care of that?
I think mental health is very important. But before you go, in the health checkup, I would tell all the API physicians that we need to do serum AMH of girls, young girls, maybe 27 onwards. Because we are seeing in IVF, nearly 1/3 of my patients are aging ovaries. So the woman may be 28-year-old, but the ovary is 40 years old. So these are the girls who need to be warned that, 70% of y'all may face difficulty in conceiving. I'm not saying all of them will. Okay, but if there is no marriage in sight or not having a child early, it helps them plan their reproduction. So I think
Right.
this awareness is really required. Okay,
Mm.
let's now come to the mental health. I think mental health is a very, very important factor. You know, in my practice, people have tried to the IVFs, 3 IVFs. I've had a patient with even 26 IVF failures who has come to me. So the mental health really plays a toll. Till the law came, the law was established in 2022.
Mm.
We gynecologists were the counselors. Like, you know, Jyotsna
Yes.
just said, I do the counseling. I'm sure, Pramila, you must be doing the counseling. You understand? So I think
Right.
that we doctors were the counselors. But now
Right.
the law has really made it important. It's made it compulsory. We have to have one therapy session with the couple. So it really brings about a lot of things which are buried. It brings it out. And see, whatever it is, I'm not saying I'm a bad counselor, I'm a good counselor, but I haven't been taught how to do it
Training. Yeah.
systematically. We are not trained for it. So I
Correct.
think this and this law, I mean, I was one of the people who was for a year in drafting it also. So these are very well thought out things which we know mental health is important in IVF, and that's why it's compulsory for an IVF center to do at least one counseling session with a therapist. So a therapist has to be attached to your IVF center, and the couple has to be counseled. So I think it's a major mindfulness meditation. You know, some girls can't meditate. I cannot meditate to save my life. I've been trying for 30 years, but just very, you know, hyper personality. So I think, you know, doing the Zumba for 1 hour, you're distracted.
Right.
Maybe playing
Correct.
a game on the phone, because, you know, it distracts you. It takes, when
Correct.
you feel stressed, do those things. And I think
Right.
that also, all those things definitely help. Acupuncture is something that our girls are going for. So there are enough studies which say that it really does not improve the egg quality or the egg number or anything, but we know that it de-stresses. You know, a lot
Yes.
of girls go for massages. So all these alternate thing and a holistic approach. I had a couple the
Mm.
other day who said, we want to do panchakarma therapy and then come to you.
Yeah.
I
Okay.
don't know
Yeah.
whether it will help me or not.
Having a
because I'm
pet
not an
at home
Ayurvedic.
nowadays has become a kind of relaxation for
Yeah.
them.
But
True.
maybe if they're mentally at peace, you know, it's all the brain, you know, and you're the endocrinologist, you know how the hypothalamic pituitary axis works.
Correct.
So it really does.
Correct. Absolutely, fully agree, because your point is absolutely right. They should do the things which de-stresses them. We
Yeah.
can't force to do one particular activity, whatever activity. Some particular patient may like to play the keyboard, somebody may like to do something. So there may be a way of de-stressing for each one of them, and they may find that to be the best way to do it. I fully agree. So Dr.
Okay,
Bharti,
Pramila,
now
I need
when
to
we
sign
are,
out.
please,
I
Dr.
am
Nandita.
really
Yeah.
sorry, but thank you very much. Thank you, Dr. Sangram. I'm really happy to be here, but I need to jump into another webinar.
Oh,
Okay.
sure. Thank
Thank
you,
you.
Dr. Nandita, for being a
Bye.
part of this panel. Really excellent
Bye-bye.
discussion. Thank you.
Can I just have a word?
No, we are continuing. We are not stopping.
Doctor,
Dr.
about
Nandita,
Dr. Nandita. Dr.
please,
Nandita. No, she
please.
was telling about free charity work and something like that. When she was Foxy president, I think Ala, she's just raised that issue. All of us should conduct at least one free delivery that year.
Yes.
And in a corporate hospital, I did that for a very high risk IVF pregnant patient. And she really put that across India amongst all the gynecologists, actually.
Great. That's a great
Thank
achievement.
you,
Very
Jyotsna.
nice.
I'm so happy that you still remember it. And
I did that for a very high risk patient. I requested my Manipal, no, let's not charge this patient. Let me do
Great.
Great.
That's
Yeah.
a great thing. Yeah. So, so Dr. Nandita, thank you. Thanks a lot for your discussion. Thank you. So we'll continue with this. Dr. Bharti, we just wanted to ask you one thing. Like, we are talking so much about the urban setup, and we can give them the best of the things, like whatever is available, we can offer them the oocyte preservation, everything. But the thing is, what about the rural population? I know all of us are practicing in cities, so we don't have like typical not practicing in a PHC, but still we get a lot of rural patients. So we see the difference when we talk about urban person and they are doing all the tests, they have all the facilities. But when we're talking about a rural population, they may be able to come once in a year or once in 2 years. And even during pregnancy, they can hardly make 3 to 4 visits. So how do we cater to them? What are the things we can do, or what
do you suggest, because API is part of this, Karnataka API is part of it, what as organizations, how can we help them? Like, we are all from different background and we are from different specialities, but what best we can do? Because we always keep on talking about the best of care. But at the rural level, when we are talking, they're not getting the best of care. We are hardly giving them a minimal care. So what is your take on that?
Well, Dr. Pramila, I come from a semi-rural area. I would say Hassan is not a rural urban area in any way.
Yeah.
And we see 90 to 98% of our women are all coming from the rural areas, from villages. They travel 15, 20, 40, 50 kilometers. And they are all very low middle income group of farmer communities with, as you said, very little resources. So first thing is how associations, yes, as practitioners, we try to do the most essential things for them. We sit and talk with the family. We counsel them how to cut costs in other things so that they do not compromise their health. And we tell them that their health is wealth. That's what I put it across to them. And I tell them that you have to cut costs, either when you're pregnant or you want to have a general checkup, you'll have to cut costs on the celebrations during your festival time, cut across your clothes that you're buying, the jewelry that you're buying. And I always tell them that when you get a marriage, any rural area you go, there is no marriage which is costing them less than 8 to 10 lakhs. So I just tell them, put away about 50,000 to 80,000 so that you can use it for your health needs. That's one point I always tell them. The second thing is the government of India has come up with excellent programs which have to be utilized, and the people in the public sector have to have a commitment. And we as private practitioners have to have a private-public partnership. So, for example, in Hassan, I would tell you that we, the Hassan Society of Obstetrics and Gynecology, a very small community of about 40 to 50 of us. For the past 15 to 20 years, we conduct not health camps, is not the massive health camps. We have clinics, health clinics, where we go every 2 weeks. Once in 2 weeks, we have one of our own specialty gynecologists going on a roster system. We go there, we do their health checkups, and we tie up with the radiologists to see that their scans are done free of cost. They are tied up with us. If possible, during the delivery, we give them concessional prices or we give them free of cost. And also along with that, we ask the pharma people to pass on their samples so that we can have the antibiotics, the calciums, the tablets. This is one we do. We get the pharma people, some of them, to do the thyroid test for free, the hemoglobin for free. We are doing these. And on the same perspective, I would request all the other associations to join with us. We partner with the government of India or the government of Karnataka programs when they conduct their non-communicable diseases programs. We go there and we as gynecologists, we do the checkups and we bring back the high-risk patients and we do what is best for them. And we also have one program where they say each one adopt one, where what we do, each one of us, for example, the HPV vaccination. For the last 1 month in Hassan, we have vaccinated 2,000 girls for free of cost. Even the government has not been able to do this. So this has come from social responsibility by many of the people. There are people in the society who are willing to give, who are willing to donate. We have to find an avenue. So I always tell all the corporate people who come to do the webinars and the CMEs in our place, I tell them, please don't host webinars, CMEs in the star hotels. Let us go to the villages and do preventive programs. It may be a cardiology CME. They have the CME in the evening. Let's go in the morning and do an NCD checkup for all those one village or two villages. And it has to be an ongoing program.
Absolutely.
Unless it is an ongoing program, nothing brings results.
Correct.
So this is
Absolutely.
what we are doing in our community. We have taken in the IMA Women Doctors Wing with us. We have taken the pediatricians along with us. And we go and we have the ongoing program. We have a helpline where say anybody, we go to the schools and we do the adolescent health programs. And we tell them that anybody from the school or the college comes with a principal's note that this child is from this college or this lady is from this college. We gynecologists who have empaneled on this voluntary scheme, we have our names and phone numbers given to them. We do it free of cost for them. So that is our commitment, very little commitment to society. But I would request all the other associations. Like I know the API has a lot of funds. They have also put it across to us that we will partner with you people. Dr. Chandraya, who is the past president, has repeatedly told me, Dr. Bharti, if there are any community programs, please let us know. We will like to partner with you. But my mantra is I never do the mass camps. I never go and give them free samples. I only go and do the regular height, weight, BMI, hemoglobin, thyroid, and call them back for the gynec checkup and the breast examination to our clinics where it is done free of cost. We address the self-help groups. The Sri Shakti, Sanghas, they have their monthly meetings. We go to them and then they come back with the attendance register and they see that all the women in their Sangha have an annual checkup free of cost by our association. And similarly, we have the Indian Red Cross. Indian Red Cross in Hassan is doing a wonderful job. I'm a director of that too. We have 2 days, that is every Tuesday and Friday, in the in the Red Cross Association, we have free clinics running from 4 o'clock to 6 o'clock, where the general checkup, we have a physician, orthopedician, we have pediatrician, a gynecologist, everybody attending, a dentist, an ophthalmologist, attending the clinic, a dermatologist. We do their hemoglobins, their thyroid tests, their blood pressure examination, and their blood sugar examinations. And few of the drugs we are able to give them free of cost. We buy the generic drugs, we give them, and all this comes by contribution by the members. And my gynecological association, I tell them each one donate or each one sponsor one. So if there is a will, there is a way we can do it. We go out to the villages and have flyers, have posters in local language. On the radio, on the television. And that's how we spread the message of health awareness and how they are supposed to look after their health. Then cost or affordability does not become an issue because we can cut costs wherever we can.
Absolutely. So, Dr. Jyotsna, what is your take on this? And like Dr. Bharti alluded to what they are doing in their place. So, what is your take on the rural health for the women? Sorry. Please go ahead. Rural health, like how do you help them? What are the ways your association or from your area, how you are taking care of them? Or are you doing any such programs in your place also?
Though I'm attached to a corporate hospital, that is a small part of my practice actually. Most of it I spend in voluntary work. Just to continue with what Dr. Bharti said, how we all can each one teach one. Likewise, how each one can help another one. Yeah, like that. So there
each one treat many.
Treat many, exactly. We had an organization called as Satya Sai Trust, started by alumni of the Satya Sai School, and a very good endocrinologist. I don't know if you're aware of Dr. Satish Babu leading the.
I know him nicely.
So,
I know him.
So there are some 60 to 70 of us gynecologists every month, just once a month only, interior rural Karnataka villages. We used to go, PHCs we used to go. We were supported by somebody who entered the data in the system, and somebody to distribute medicine, somebody to check the BP and height, weight, and all that. So this is how we gave an antenatal care. And in that short span of few years before Satya Sai Medical College came up, the maternal mortality significantly reduced. Anemia reduced so significantly that first year we used to see a lot of them with 5 and 6 grams hemoglobin. And the next year onwards, when we continued seeing them, the level of education and the level of awareness and the supply of drugs and we also involved Anganwadi workers with us. So we pushed them to go to door and give iron and calcium.
They can help us the best.
And they wouldn't take otherwise. So we insisted what medicines they are giving is all like directed by us. So you can safely take them. It's not that your baby is going to be big and you're going to land up in C-section and all that. And one more noble thing that Trust did was in the 7th month Godbarai, like baby shower they used to do. So drumstick plants were given to them. So we all know drumstick improves hemoglobin percentage. So we used to tell them, by the time you deliver, this should have become this bigger plant. And by the time your child is 1 year old, it should be giving drumsticks in that. So that was the best way of encouraging. And in addition to that, in Bangalore itself, now that there is Satya Sai Medical College, those things have stopped. for the last 2 years. But here I involve myself in going to schools and colleges and giving health education, mental education, psychological education, women's health. And to the perimenopausal women, I involve myself in Jagriti program, where we educate. It's not about the corporate world, it's the mixture of the world. And schools we adopt for this health education, HPV vaccine education are all like, aided schools or government run schools where
Correct.
there's not much of access to Google knowledge, or parents aren't pushing them to go for HPV vaccine. This is the kind of service probably, though it's very small, but still I would like to do it.
Great. No, all of you are doing a great job, I should say. And Dr. Nandini has also joined us. So I welcome Dr. Nandini. So Dr. Nandini, we are almost coming to the end of the panel. We have few questions for
I'm
you
so
because
sorry.
no, it's absolutely fine. So we were discussing the gynecological aspect. We did discuss about the women's reproductive health. We did discuss about the rural area programs for women and their nutrition. So as a physician, because you basically deal with the other problems as well, because when we are talking to gynecologists, they basically deal with more of the gynecological issues for which the girls or the women are brought to them and during pregnancy and IVF. But for you, it's an overall thing. So as when we talk about women in general, what do you think that from the childhood onwards, what are the factors which we need to keep in mind? And when we are talking about women's health, what are the things you recommend? Like if we have to take care of girls, if we have to take care of women before they plan for pregnancy. So as a physician, what is your opinion and what is your take on that?
Yes, thank you very much. It's a very relevant and important question to be addressed. First thing is that, as we know, that we have to start young. So from a young age, girls should be taking care of their health in the form of proper diet and maintaining a good weight, because obesity in the younger woman would ultimately lead to many metabolic disorders and metabolic syndrome, polycystic ovarian disease. I'm sure they have already been discussed.
Yes.
And later on, it can give rise to certain gestational problems like gestational diabetes, obesity. So maintaining a regime for minimum weekly exercise, proper healthy diet is very important for the young girls. And this Indian genes, what happens is that we have a tendency that when there is a generation with low birth weight, the next generation tends to become obese and next generation tends to have hyperglycemic tendencies. So we are the South Asians specifically, we are very prone to all that. And even with a normal BMI, as we all know, we may have a greater waist circumference, which is metabolically detrimental. So in that way, we need to be more careful about our health, especially the South Asians are more prone to all metabolic diseases. Apart from that, women as they age, there are two, I should say, peaks when women need to be careful. One is the young girls who are going into the adulthood. Another is the age when people are going into menopause and their hormonal protection is lost. So in those two groups of age, as physicians, we are catering to many problems. The perimenopausal age group, again, they are coming with hypertension, coronary heart disease, diabetes, and it is growing. In India, it is seen that diabetes and coronary heart disease among Indians is growing like anything. It is growing among men also, but women are catching up. And in the age group, which is postmenopausal, they have a higher incidence of all these metabolic diseases. And
yeah, so well said. So that's what I think we are almost coming to the end of the panel discussion. So what we have discussed today is definitely on the occasion of the World Health Day that we need to be cautious about women's health from the beginning. So before the child is born, only what the woman eats or what she takes or how is her exercise pattern will decide what problems the child will have in future. We know that osteoporosis starts from the womb, and we have to be very careful about the nutrition of the girl child, because that is one thing which we still face in our country. Many a times they are not given enough calcium, their intake of protein is very poor, and then they have problems when they reach adulthood. Now we are seeing more and more obesity in young girls, and that's becoming a big problem. And we need to counsel the parents about good nutrition, healthy nutrition, and good intake of protein. And Dr. Bharti would like to add something, please. Yeah, you wanted to say something, please.
See, we are just, I would say we need to focus on the men and women as well, because the man's health is equally important to see that the to be born fetus is healthy, because his substance abuse, alcohol or smoking, all these are going to have, and obesity, diabetes in the man also is going to have. So I think it's time that we start talking about the couple and not just the woman.
Absolutely. I fully agree with you. There is no controversy on that. But today, because we were trying to little bit talk more about women, because that health is very important, and men are always being discussed. So it's not that they are not being discussed. But anyways,
preconceptional care. The preconceptional care has to be for both. That's what I meant. Not the other way.
Absolutely agree. I fully agree with you. So when we talk about preconceptional care, it's the couple who needs the preconception care rather than just the woman herself. And we also need to be aware that even after the child is born, we need to counsel the women about their health, because we see so many gestational diabetes, and they come with type 2 diabetes within 1 or 2 years of their deliveries, because they are not taught about, or they are not aware that they have to take care of their health, get themselves regularly checked for their diabetes status. So that's another thing which we need to counsel them about. We know that women get heart disease, and they also can get heart disease more so in the perimenopausal time, and their mortality rates may be even higher. And it has been clearly seen that women take less statins, they take less care of their heart diseases, they take less care of their metabolic problems. So that's another problem which we see. So that's why it's more important that when we are discussing today with API and Karnataka API there, we need to give this message that we as organizations, we need to spread this awareness amongst the public, and as organizations, it's our duty to create and do more awareness programs, and maybe in local languages, to make people aware about what exactly is the need for healthy brought up of a child, not only for a girl and also for a boy, because we are seeing more and more obesity epidemic for both girls and boys, and we are also seeing more and more metabolic diseases and heart diseases coming early for both the genders. And anybody would like to add something? Otherwise, I
can I just add something?
Yeah, please.
I do not know. Since you're an endocrinologist, endocrine disruptors are the major problem for all the diseases what we discussed today. In fact, infertility thing has boomed up because of that. And you name it, every condition can be associated with endocrine disruptors. So I just took a keen interest in microplastics, and I read about it, and I just gave 1 or 2 talks here. And in my road, I have educated all of them in my road. They have told them not to use plastic bags and not to use single-use plastics. Probably if we as doctors educate everybody, some of the things like syringes or medical things we cannot avoid, but avoidable plastic use, if we can avoid, definitely we can save the world, we can save the environment, we can save the next generation from all this.
But also when we talk about endocrine disruptors, just not the plastics alone. We know that even the cosmetics or even every daily use thing we use, everything has endocrine disruptor in it. So that's also even the hair oil, the cosmetics, any of the cosmetics which use, there are so many parabens and other things in most of the cosmetics which we never read the labels. So these things have to be taught to our public, because unless, and we should tell our public to read the food labels. In India, public doesn't have this option of, or they don't know that they have to read the food labels. When they buy some food, they have to read the packet and see how many calories it has, how much trans fats it has, because then only we can help them to understand what best is there, what best they should take for their health. So with that, I thank the API Karnataka as well as the API and Dr. Sangram for giving me this opportunity to moderate this panel. And it was really an excellent discussion. I thank Dr. Nandita. She already had to go for another meeting. I thank Dr. Bharti, Dr. Jyotsna, and Dr. Nandini for their excellent discussions. And I hand it over back to Dr. Sangram for the closing remarks.
Thank you so much.
Thank you, Dr. Pramila Karla. It was a wonderful moderation as usual. there is nothing left
Thank
to thank all the panelists, speakers, and the delegates. Thank you one and all for
Thank
sparing
you,
your
sir.
valuable time and to make
Thank
this
you, Dr.
program a grand
Sangram.
success.
Yeah.
Thank you,
Good
Dr.
night.
Pramila, and my co-panelist, Dr. Jyotsna, Dr.
Yeah,
Nandini, and the
thank
entire API. I think we have to have more such collaborative sessions
Absolutely.
so that the wholesome health is addressed.
Discussion
Thank you
is
very
done.
much.
Yes. Yes.
Thank you.
Thank you.
Good night.
Thank you one and all. We'll
Thank
sign
you
off.
and good night.
Thank you, sir.
Thank you.